Hello everyone, I am Dr. RMD, and without any further delay, I am going to tell you recent updates which will be asked in upcoming INICET. We have just 23 days left and we'll be starting with this recent updates. So this PDF is divided into two parts, recent updates with MCQ predicted questions, and second is recent updates pertaining to guidelines which are very important from point of view of recent updates like 2026 stroke update guidelines, NRP 9th edition guidelines. So you won't find this anywhere in any of the sources at a single place, and that's the reason behind this video and behind this PDF. So first we have important topics from medicine. Here you'll also find probability of questions that can be asked. Okay, what is the probability? So there is very high probability that GLP-1 agonists are going to be used. Okay, and in that question will be based on semaglutide only. You can expect a strong question from this, a very high probability of question asked from semaglutide. Okay, so there was a select trial which was conducted, and since Ozempic and semaglutide they are going to come into market in India, so that's why this question has very high significance of being asked. Okay, second is use of SGLT2 inhibitors, that is empagliflozin and dapagliflozin in heart failure with preserved ejection fraction. So this is a recent update which you should know. Next, third is regarding amyloidosis. There is a new drug known as lecanemab which actually clears amyloid protofibrils, and there is one more donanemab. About this also I'll tell you in detail in the upcoming slides. Fourth is renaming of NASH, that is non-alcoholic steatohepatitis, as MASLD, metabolic associated liver disease. Okay, so this is important. And there is one drug which was a recent update, resmetirom. Okay, resmetirom. How to remember all this I'll be telling in the upcoming slides. Okay, this is just an overview. Before going to INICET exam, you just go through these updates. Okay, next, JAK inhibitors, baricitinib is recently used for alopecia areata. Okay, and what is the mechanism of action of tofacitinib? It can be a related question to this. In pharmacology, you have new drugs, and in this the most important is this antibody drug conjugates which are used for HER2 breast cancer. Okay, so this is ADC approved, that is antibody drug conjugate is approved. What is the name of the drug? That is trastuzumab and deruxtecan. Okay, next is on SGLT2 inhibitors which we have already seen. Next is bispecific antibodies which are used in case of T cell engager in ALL. Okay, that is an acute lymphoblastic leukemia. Important point is this Nobel Prize. Always they'll be asking one question based on that. So for miRNA it was given in 2024, and one more is PD-1 ligands, that is checkpoint inhibitors. What is the most common one, most common side effect of this? Okay, that is the most common endocrine adverse effect. Okay, similarly in pathology you have CAR T cell therapy, which is a repeatedly asked question, and CAR T cell therapy targeting this BCMA is used in which? It is used mainly in multiple myeloma. Also CRISPR technology, definitely one question will come because AIIMS always has this research being conducted in CRISPR technology. Liquid biopsy, this is a new entity. Okay, so this is difference between cfDNA and ctDNA. Okay, so ctDNA, all these details I'll be giving in the further slides. Okay, it is specifically used for tumor derived cells. Okay, next, tumor microenvironment, all this you read. Okay, then regarding epigenetics, so which HDAC inhibitor was used for T cell lymphoma, that is romidepsin. Inborn errors from metabolism, especially on which enzyme deficiency in Gaucher's, and which is a treatment for SMA, that is onasemnogen. Okay, next, these are some new things. Okay, also antimicrobial resistance. Then in OBG you have some PCOS guidelines which have changed, Rotterdam criteria, what is the first line ovulation induction agent, SMA gene therapy, what you use. Okay, what about MIS-C? Similarly in surgery, radiology, and in orthopedics, majorly regarding robotic surgery updates, ERAS protocol. Okay, and AI in radiology, which is the first FDA approved AI for diabetic retinopathy, it is IDX-DR. So these are some recent trends which have happened in AIIMS, also PGI, NIMANS, and JIPMER. Okay, so basically this PDF, this recent updates list was made from point of view that these examiners mainly will be from these institutes only. So they will be knowing topics whichever are actually research topics. So these are all the research topics that are going on in AIIMS and other institutes. Okay, similarly in neurology we have many important topics, especially for NIMANS point of view. So we have esketamine, which is an intranasal NMDA receptor antagonist for treatment resistant depression. Okay, so it is given by intranasal route. Definitely one question will be there on this. Next is alpha-synuclein, that is the skin biopsy for alpha-synuclein is the recently updated non-invasive early test for Parkinson's. Similarly, stroke thrombectomy maximum window has been increased to 24 hours. Anti-VEGF that is used is faricimab. Okay, and TIVA index and TIVA, that is Sugamadex. Okay, so these things, okay, related to anesthesia. So these are the most important things which have very high probability, more than 90% probability of being asked in upcoming INICET exam. So now detail with regarding to this also I'll tell you some important topics only. Okay, for example, AHA and ASA guidelines on acute ischemic stroke, the guidelines have changed recently. So what has changed? Altiplus is preferred now, and there is a strict 4.5 hours window. This was the previous standard, and now new update in 2026 is tenecteplus is the standardized one, and thrombolysis window has been increased to 24 hours. Okay, so this is the main shift in the timeline. This has probability of being asked 99% because stroke is a very important topic for INICET. Similarly, surviving sepsis campaign. Okay, so here target map has been increased. Earlier it was more than 65, now it has been between 60 to 65, okay, for adults more than 65 years. Similarly, you will find heart failure, SGLT2, what is the recommendations, gold COPD 2026 updates, that is new update is blood eosinophils have been strictly dictated for ICS initiation at more than 300 cells, okay. So these are the new things that have been added, okay. So MSLT nomenclature I have told you. Similarly, KDIGO guidelines, earlier AC inhibitors and ARB were only used, and now it has been integrated with finerenone, okay, finerenone, which is NSMRF, which is used, okay. Similarly, NRP 9th edition changes in RSV prevention in children. You have new drug that is nirsevimab instead of pembrolizumab. In neonatal seizure, there is ILEA update, that is earlier phenytoin was used, now phenobarbital is the first line of choice, okay. It is not phenytoin in children, it is phenobarbital in neonatal seizures, okay, not in childhood seizures, in neonatal seizures. Similarly, early onset sepsis calculator has been introduced, PPH updates. So there are many such important updates. There are around 45 to 50 updates, which will hardly take us some 30 minutes. So just revise this PDF before you go. The link for this PDF will be given in the comment section. Please go to that link. It is free of cost. You don't have to pay anything. Just go ahead and download this PDF, and you can use it for upcoming INICT, and you can use this for upcoming NEETPG also. So I suggest you, because at least around in INICT at least 10 questions, at least I'm telling at least 10 questions will come as recent updates, because all these research topics I have gone to the website of AIIMS, NIMANS and PGI and JIPR and taken their important research aspect, their current research trends only I have taken, okay. That's why you'll see like AIIMS, they conduct so much research on genetics, so you'll see so many genetic questions are there, genetic topics are there in this, okay. So all the best for upcoming INICT. I'll be releasing a video on INICT 2026 May, last 7 days revision strategy also. I'll be releasing it soon, okay. So till then, all the best.